I suppose I'm humbled that there's such a big turnout for the meeting today. It was something that we thought about over the summer. We had just finished the HPV meeting. We took a day's break. And around the 10th of July said, you know, we as a college need to come out and speak to the issues that were brought up around the cervical check at the time. And it was prior to the Scally report. And this was absolutely team effort. We had 3 of the main faculties that were involved in cervical check within our college. We still have, Institute of Obstetrics and Obstetricians and Gynecologists, the Faculty of Pathology, and the Faculty of Public Health. So I'm an infectious disease doctor, so I'm a physician, but felt it was important that we came together and I suppose put together what we felt was a programme that would subsequently address a lot of the issues that was in Dr. Scally's report. And here we are today. Not only was it an effort of the college, but we reached out to people who we thought were really important in informing how we move forward and how we learn from the cervical check issues that had been brought to light in late April and early May, and the subsequent publication of Dr. Scally's report. How did we do that? Like most things in Ireland, pick up the phone. Talk to my colleague, Mr. Ken Mealy, who's the president of RCSI, talk to the radiologist, talk to the chief clinical officer, the chief medical officer, reach out to the patients. I said earlier when I introduced the meeting how important patients are in how we deliver service. They tell us how we do we do it well, how we can be doing it better. And I suppose I've had the privilege of working in another jurisdiction for 7 years. And you always think the States is the be-all and end-all, but there is a reason I came back to Ireland, to ensure that we bring all the ideas, as many of the speakers were today, bring back the good ideas and truly make a difference to the delivery of healthcare in Ireland. And I think that's absolutely essential, and it's a challenge that we have retaining our graduates. I think it was absolutely essential earlier today that we listened to the voice of the patient. And this is what I try to tell the medical students or teach them, and I hope by example, is that you need to put yourself in the position of the patient, or if you can't, assume it's your grandmother, your sister, your father, your uncle, because they want the experience. And people will tell you, patients will tell you, I know enough, I trust you, doctor, keep me informed. And that's absolutely essential. And I think that was very clear in Lorraine Walsh's narrative today. It's extremely difficult for a patient to come up here in front of a crowd of medics, nurses, policymakers, to actually impart their deepest sentiments and how things impact on them. So, but it's also important that she does it not just in front of the medical community, but in front of those that make policies and organise our health service. While we're a college, we don't actually deliver the service, but we have our expertise available for those who do. And following on the minister's comments earlier, that's our job as the College of Physicians, to absolutely support the policymakers and those who provide service within the country, so that we can give the best care possible to the people of Ireland, and indeed beyond in this college, because we do have a lot of international fellows, trainees, members who deliver care, often in resource-poor settings. It's been a particularly difficult few months for patients and their families, and I think we've heard about that. It's been difficult for the medical family, and the medical family is not just doctors. Those of us who work in the front line, it's absolutely a team effort. We work hand in glove with nurses and our allied healthcare professionals, and having things happen to patients that we don't mean to happen but do happen has a huge personal impact on healthcare professionals. They take it home with them. It affects how they deliver care. So I think moving away from the blame culture and having a just culture with peer support, so that when things happen that shouldn't happen, that the ability to have open disclosure absolutely needs to happen. And underpinning that is our ability to support our colleagues, and whether they're doctors or nurses, and also not having a blame culture. We do have challenges retaining our medical graduates here. It's not just here, it's an international problem. But we still attract some of the smartest kids into our medical schools here. We have an increasing issue with them going to Australia, but hopefully we're working very hard to identify why and how we can get them back here. And I think probably changing the narrative from the blame game to a just culture, that there are peer supports that are really important for patients and really important for the healthcare professionals who deliver them. So our doctors have been portrayed in variable ways over the last few months, and everyone says to me, well, why don't you go out there and talk? I mean, I can go out there and talk, but as Liam Plant said earlier, I don't know anything about cytology or colposcopy, but I do know the important things that are necessary to be a good doctor. And one of the challenges we have as doctors is that we're 100% clinical. So if something comes up like the cervical check and response to same, everything that's done is 20%, 25%, 30% extra on to our ability to deliver 100% quality care to our patients. So we don't get dedicated time to do postgraduate training, to respond to issues that and crises that come up on our health service. So it's actually hard to find people to step up to the mark. I met the minister on Monday, and I did advocate the need for identifying time and space for people to develop issues around guidelines, respond to issues like cervical check, but they can't do it as an extra. They need ring-fence time to properly respond to issues and correct them and learn from them. And that's what the public deserve. They don't deserve 100% and then another 50% on top of your job, because it won't be done as well as it could be given the fantastic expertise we have in the country. And I think that was clear today how good the quality of our healthcare professionals are in this country. Cervical check has saved lives. We've had a 7% year-on-year decrease in cervical cancer. And the patients' advocates have been very adamant and supportive of the need for HPV vaccine and access to screening programs. And it was Professor Gráinne Flanley who took on the role. There was money at the time. The health service, in the downturn, there was a moratorium on recruitment, and the service probably wasn't as resourced as it could be. So hopefully that will change. But not only had cervical check under her leadership up to May, but those people who work on it have made a difference in people's lives, and we would like to see that continued. Also, for those people who are diagnosed, who go on to the colposcopy service, which is run by our gynecologists, and our nurses are there to care for patients. And we want to ensure their well-being so that the care that they give can continue to be as good as it always is. I don't think I'm going to say too much more. We are a college that is available and has engaged with the leaders in our health service to do our best to ensure that patients are listened to, that they're part of what we do. And in this college, we are planning to have a public engagement committee here that works with us to educate our trainees and to inform how we can do things even better in what is really a very stressful environment. I particularly want to thank a number of my colleagues here who have done a huge amount of work in the background to ensure that this day, and in fact, a lot of the issues that have been dealt with we've contributed to the Department of Health and the HSE over the past few months. Those from the Institute of Obstetricians and Gynecologists, Faculty of Public Health, Faculty of Pathology, have been involved. We don't go out and blow our trumpet, but we're there. We're on the committees. We listen to patients. I particularly want to thank Dr. Cleona Murphy, Professor Donal Brennan, Professor Louise Burke, and Dr. Emer Shelley and Dr. Peter Boylan, who gave me the introduction, who's been a really great support to the college over the past few months, for their leadership, for their commitment for us to deliver on our, I suppose, collective response to SCALI, which is effectively eradicating HPV-related diseases and cervical cancer in this country. I'm particularly grateful for my colleagues from overseas. I picked up the phone and Louise picked up the phone to Vancouver and to Melbourne, speaking to Deborah Money, who'll speak next, and to Marion Saville. And they could not have been more helpful. They wanted to come, leave busy jobs, come over here, help us, and help us make a difference. I'm also grateful to the staff of the college, Royal College of Physicians, who've made this possible, work closely with Siobhan Creighton and O'Shaughnessy, Rebecca McEntee. I'm sure there are many others that I will forget, but you'll see them in the background. But we're here to help. We want our expertise to be used, and we want our doctors to be supported so that we can provide the best possible care to our patients. Thank you.